RSV in children, symptoms, treatment, and what parents should know. Respiratory syncytial virus, also called human respiratory syncytial virus and human orthopneumovirus, is a common, contagious virus that causes infections of the respiratory tract. Almost all children catch RSV at some point before they turn 2, the U.S. Centers for Disease Control and Prevention says. Most adults who catch it have a mild illness. For those who are elderly or who have chronic heart or lung disease or a weakened immune system, it can be dangerous. But RSV can be especially tricky for infants and kids. RSV causes a mild illness that can be managed at home. On average, an infection lasts 5 days to a couple of weeks, and it will often go away on its own, the CDC says. Sometimes, the cough can linger for up to 4 weeks. Some symptoms of RSV include a runny nose, a decreased appetite, coughing, sneezing, fever and wheezing. Young infants may seem only irritable or lethargic and have trouble breathing. Parents should watch for any changes in behavior, she said, including taking longer to eat or not being interested in food at all. The child can also develop a severe cough and some wheezing. It's also important to watch for signs that your child is struggling to breathe or breathing with their ribs or belly. When it comes to RSV, parents should be especially cautious if their children are preemies, newborns, children with weakened immune systems or neuromuscular disorders, and those under age 2 with chronic lung and heart conditions. Parents should be really astute to any changes, like in their activity and their appetite, and then pay particular attention to any signs of respiratory distress. Parents should be really astute to any changes, like in their activity and their appetite, and then pay particular attention to any signs of respiratory distress. RSV treatment. Testing is important because treatment for things like flu and COVID-19 may differ. There's no antiviral or specific treatment for RSV like there is for the flu, nor is there a vaccine. But if your child is sick, there are things you can do to help. Fever and pain can be managed with non-aspirin pain relievers like acetaminophen or ibuprofen. Also make sure your child drinks enough fluids. RSV can make kids very dehydrated, especially when they're not eating or drinking, especially when we're talking infants, Maura said. Once they stop eating or their urine output has decreased, they're not having as many wet diapers. This is a sign they may have to go to the pediatrician or emergency department. Talk to your pediatrician before giving your child any over-the-counter cold medicines, which can sometimes contain ingredients that aren't good for kids. When to go to the hospital. RSV can be super dangerous for some young infants and younger kids, particularly those that are less than 2 years of age. Labored breathing is a sign that a child is having trouble with this virus. RSV can turn into more serious illnesses such as bronchiolitis or pneumonia, and that can lead to respiratory failure. If you see that a child's chest is moving up and down when they breathe, if their cough won't let them sleep or if it's getting worse, that might be a sign that they need to seek help from their pediatrician or take them to the emergency department, because then they might need a supplemental oxygen, or they may need a nebulization treatment. Some children may need to use an oxygen tent. Those who are struggling a lot may need a ventilator. Some measures for RSV on these kids with oxygen may include 4 fluids, respiratory therapies and even suctioning. How to prevent RSV. The best ways to prevent RSV infections, doctors say, is to teach kids to cough and sneeze into a tissue or into their elbows rather than their hands. Also try to keep frequently touched surfaces clean. And most of all, if anyone is sick, child or adult, they should stay home so they don't spread the illness. Thanks for watching.